Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions in DS3, and welcome to this edition of Dental Sleep Medicine Insider. Today I'm going to talk about home sleep testing. Now, we all know that PSGs have been around for a long time and they're what we call the gold standard, but I personally think home sleep testing is a better way of testing our patients for many occasions. And we'll talk about 3 ways that I know about getting our patients tested. Some of the advantages, first of all, of home sleep testing are it's lower cost to our patients. They have better access to care. We can do more nights when we test our patients. We can actually obtain a better normal night's sleep because they're sleeping in their own home. And certainly patients would prefer this in most cases, so it's more readily accepted. There's some negatives that maybe we don't gather as much data. We don't do sleep staging. We may not know when our patients are asleep. We don't have the ability to control body position and the leads on our patients. And we're really only going to do home sleep testing for patients when we're looking for airway problems, not many other sleep disorders. Utilizing home sleep testing, there's really 3 categories that I like to talk about today. One is you can work with a physician and do sleep testing through them. 2 is you can purchase your own equipment and get it interpreted by a board-certified sleep physician and get a diagnosis or titration study that way. And 3rd is you can work with one of these many companies out there who actually deliver the home sleep testing device to your patient. They bill the patient's medical insurance directly and co-bill the patient for any portion they have, allowing you to get a diagnosis with just basically filling out some form or clicking a button if you have DS3. So let's talk about referring to a medical physician first of all. This does require some effort on your part. You have to set up a meeting with the physician. I would recommend that at the very least so that we're all on the same page. We have to find the physicians that we want to work with, and hopefully they will refer the patients back and go along the protocols that we set up with them. Ideally, they may even do PSGs because occasionally we need those, but I would highly recommend that you're educated on what you want and have a conversation with them before you meet with the physicians. And this is great for our Medicare patients and in some areas where we as dentists may be hindered in ordering our own home sleep tests. The second way, and the way we did this for years, is you can purchase your own home sleep testing equipment. And I just want to say, if you're going to use home sleep testing without the direct supervision of a physician, you need to be aware of your state and local laws pertaining to your dental licensure, as well as Medicare guidelines. In some areas, dentists may not be able to order home sleep testing. But in the areas that are, you still have to have a physician who interprets this data. So whether we have our own equipment or even if we use the third-party home sleep testing companies. So if we're going to purchase our own equipment, there are some advantages to this. Number one is we have it right there in front of us and we can hand it to the patient. So we always have it available. It may be easier flow in our office. We can use it as many times as we like. We can use it just to kind of screen our patients and to get them going into the system and getting them to see what's going on. We can review the raw data for us and our team and the patients to actually see each breath and the patient breathing and quitting breathing and snoring. And that information is very powerful. And as we do that, we learn a lot more in our offices, and our team has a better appreciation of what's going on in these patients. The negative is the cost. You've got to buy your own equipment and the hassle. You've got to deliver the devices to your patients. You've got to be responsible for expendables. You've got to download this information. If the patient messes it up and they don't get a good signals for some reason, it's probably going to be on you to redo it. And then you're in charge of finding a physician to upload this information to so that they can do an interpretation and ideally a diagnosis for our undiagnosed patients. And as far as billing goes, it's kind of difficult for us as dentists to get reimbursement from medical insurance for home sleep testing. It can happen, but it's just not as readily available as it is for physicians charging for the same procedures. Now, my preferred way in most cases is to work with one of these companies, and you can talk to us here at Dental Sleep Solutions and DS3, the companies we work with, that we can basically just order a test. We give the companies the information they need. They contact the patient directly. They ship them the home sleep testing equipment. They bill the patient pays them. They interpret the data usually with technologists and board-certified sleep physicians who give us an interpretation and many times a diagnosis. Now, we're not recommending that we just go from there to making dental devices in any stretch. We want to involve primary cares with everything we're doing. But once we have a diagnosis or at least interpretation, we can use that to go with our work with our physician. If we're going to work with one of these companies, The main advantage to us is that it costs us nothing. We refer the patient to them, and the patient pays them directly, and it reduces all the time and staff and energy training that we need to get equipment in our office and learn how to use it. And if for some reason we don't get good information, then it's back on the home sleep testing company's responsibility to get that to us. So in DS3, this can be just about as easy as just clicking a button. We can just hit a button, and we work with many home sleep testing companies that we transmit that data, and it comes right back into DS3. So there's how you can get your patients tested. Still PSGs, maybe you want to do them occasionally, but more in a way, home sleep testing is the wave of the future. You can work with your physicians, you can buy your own equipment, or you can work with one of our home sleep testing companies to get your patients tested. So this hurdle that used to be really big in dental sleep is now very small. So thanks for tuning in to this edition of Dental Sleep Medicine Insider Magazine, and let us know here at Dental Sleep Solutions and DS3 if we can help you in any way succeed in your practice of dental sleep medicine.